Hi, my name is Sarah. I work in a long-term care facility in Laurel County. I'm their infection preventionist. In this short video, we're going to learn some basics of personal protective equipment, as well as how to properly don and doff, and some other infection control practices and procedures. I hope you enjoy the video and you stay safe out there.
Before putting on any PPE, always perform hand hygiene. The first item you will put on or don will be your isolation gown. Gowns are worn to protect your clothing from splashes or sprays. As you put on your isolation gown, make sure you tie the top ties first, followed by the ones around your waist. Ensure that the gown, as much as possible, covers the back of your uniform as well. Once your gown is in place and covers your uniform, you can move on to putting on your mask. Procedure masks are designed to protect you from splashes and sprays. Ensure that you wear the color side out, as the color side is intended to provide protection from splashes, whereas the inside, the white part, has a wicking material that helps pull away moisture as we breathe. The top of the mask has the bendable wire at the top. As you put on, pull the ear loops and secure them around your ears. Then fasten the top wire conforming around your nose and face. Pull the mask down under your chin to fully secure. The mask should cover your nose, mouth, and chin. When putting on a tie-back procedure mask, apply the top ties to the crown of your head and secure. This will be followed by the bottom ties secured around the nape of your neck. Then conform the wire at the top to your nose and face, followed by pulling the bottom part of the mask under your chin. A N95 respirator mask is what we use to protect ourselves from air particulates. It filters out at least 95% of airborne particles, including large and small particles. When putting on a N95 respirator mask, cup the mask under your chin. Pull the strings at the crown of your head. The top one will remain there, while the bottom one be at the nape of your neck. Position mask to fit securely on face. Conform the nose piece at the top to your face and nose. Pull the mask down to fit securely under your chin. Once the mask feels secure and in place, perform a seal check. This seal check should be performed every time you put on the mask. To do a seal check, place your hands over the mask. Exhale gently. There should be a slight positive pressure that's being built up inside the mask without any leakage of air at the seal. If you feel air movement on your face or fogging of your glasses or lack of pressure being built up inside the mask, then your seal check was not successful. You would then adjust your mask, secure the nose piece tighter, pull it under your chin, and perform a seal check again. A face shield will protect you from splashes and sprays. It will also help protect, to a degree, your mask from becoming contaminated. A face shield not only protects the front of your face, but also the sides. Safety glasses are also an acceptable means of eye protection. They protect you from front splashes and sprays, as well as side splashes and sprays. After your gown, mask, and eye protection are donned, perform hand hygiene. Then you will put on your gloves. Ensure that your gloves are pulled up high enough that they cover your wrist and that there is no skin showing. Once all my PPE is put on, secured, and checked, I am safe to approach a confirmed or suspected case of COVID-19. If available, wear your N95 respirator mask around confirmed or suspected cases of COVID-19. If you do not have a respirator mask, a facial mask is an acceptable alternative. Taking off or doffing PPE. When removing PPE, extreme caution should be taken. The outside of our PPE is considered contaminated. First, you will remove your gloves. As you remove your gloves, try not to cause additional contamination of the hands. Take gloves off one at a time using glove-in-glove technique. Gloves should not typically be reused. If reuse is necessary, follow CDC guidelines. You will use a disinfectant wipe followed by alcohol-based hand sanitizer. Next is gown removal. Untie or break all ties. Do this in a gentle manner, not a forceful one. Reaching up at the top of the shoulders, gently pull gown away from the body. Rolling the gown down and away is an acceptable approach. Most gowns will not be able to be reused. So if possible, extended use of the gown would be preferred. Extended use means you would see more than one person, patient, or resident without changing your gown. After taking off your gloves and gown, perform hand hygiene. Before removing your safety glasses and mask, ensure you are a safe distance from the person, patient, or resident. To remove safety glasses, touch the sides of the glasses and pull away from your body. As much as possible, avoid touching the front of your eye protection, which is contaminated. If you are wearing goggles or a face shield with a strap, grab the back of the strap and pull away from your head. All reusable items must be cleaned and disinfected, then stored in a clean paper bag. To take off procedure ear loop mask, grab the ear loops and pull away from your head. If reuse is necessary, fold mask with the outside facing in on itself, then store in clean paper bag. When taking off or doffing a tie-back mask, untie the ties at both the nape of your neck and the crown of your head. Pull the mask away from your head. These may be reused as well, but are harder to do so. To remove your N95 respirator mask, remove the bottom strap by touching only the strap and bring it over the head. Grasp the top strap and carefully bring over your head. Then pull the respirator away from your face. Take care to only touch the straps of your respirator as you store in a clean paper bag for reuse. In most cases, extended use of PPE is a preferred method over reuse. Again, extreme caution is needed when removing PPE. Always perform hand hygiene before donning and after doffing PPE. Hand hygiene is the most important way you can keep yourself and others healthy. Alcohol-based hand rub is a very effective way to clean your hands. Apply enough product in the palm of your hand to cover all surfaces of your hand. You will start by rubbing your palms together in a circular motion. Next, you will put your right palm over your left with your fingers interlaced and rub. You will perform the same action with your left palm over your right interlaced fingers. Next, you will turn your hands palm to palm with fingers interlaced. Then you will cup your hands with fingers interlocked and rub with a back and forth motion. Thumbs are commonly missed. Make sure you don't forget your right and your left thumb. The last step is to get your fingertips and fingernails. Clasp your fingers of your right hand into your left palm and rotate in a circular motion. Then do the opposite hand with the same motion. Once the product is dry, your hands are safe. Typically, the entire procedure only takes 20 to 30 seconds. Only use alcohol-based hand rub with an alcohol content of 60% or higher to effectively kill germs. Wash your hands with soap and water when they are visibly dirty. You will also want to use soap and water when dealing with organisms such as C. difficile or norovirus. The entire procedure only takes from 40 to 60 seconds. Make sure to wash your hands for at least 15 to 20 seconds. You will perform the same techniques as you did with alcohol-based hand rub. The only exception is wet hands with water first. After the necessary steps, dry hands thoroughly, and don't forget to use a clean paper towel to turn off the faucet. Social distancing is extremely important, even for medical and emergency personnel. This is approximately 2 arms lengths away from a person. A safe distance is 6 feet or more. If possible, social distance while assessing the situation. It's important to expose as few people as possible, only personnel that are actually needed. In addition to social distancing, it is also important to have source control. If possible and can be tolerated, apply a mask on the patient, resident, or person you will be coming in contact with. Also, make sure your PPE is on if you are having to come in contact with a person, resident, or patient within 6 feet or less. Another important way to prevent spread of coronavirus is to clean and disinfect. Ensure the disinfectant you use is a EPA registered disinfectant that is effective against coronaviruses. Cleaning is the first step you would take. To clean, use water or a neutral cleaner to wipe down a surface or remove visible soil. To disinfect, use an EPA registered disinfectant and ensure the surface remains wet for the specific contact time. After contact time has been reached and the surface is dry, the area or item is now considered safe. Follow manufacturer guidelines on cleaning and disinfecting chemicals. It is especially important to clean reusable PPE items. Follow CDC guidelines. Do not forget to clean and disinfect high-touch surfaces such as bed rails, stretchers, wheelchairs, and other surfaces you come in contact with, including in your vehicle. And don't forget, the number one way to protect yourself and others is to frequently perform hand hygiene.
Thank you for watching this short video on PPE usage. If you have any questions, go to the CDC website for further guidance. Thank you and have a great day.